For decades, loading protocols have been a key factor in determining implant success. Conventional and delayed loading have been widely regarded as stable approaches, whereas immediate and early loading have often required more cautious consideration. But what if we could achieve high success rates regardless of the loading time? This question led to the development of the anytime loading concept. However, to make this possible, one critical challenge must be addressed: stability dip. After implant placement, primary stability gradually decreases due to bone remodeling. As osseointegration progresses, secondary stability gradually increases. However, during the transition between these stability changes, a vulnerable phase known as the stability dip occurs between 2 and 6 weeks post-placement. For this reason, loading is generally not recommended during this period. Instead, many clinicians choose to wait 3 to 6 months for conventional loading. But what if we could minimize stability dip, allowing earlier loading? There are 2 key factors in reducing stability dip. First, maintaining primary stability. Second, accelerating the formation of secondary stability. To maintain primary stability, minimizing bone trauma during placement is crucial, as excessive damage can weaken initial fixation. So to achieve optimal fixation for anytime loading, a traumatic approach with a precise drilling protocol is essential. However, conventional drilling protocols have limitations. This is because most protocols categorize bone density simply as hard, moderate, or soft bone. However, actual bone density is more complex than these simplified classifications. Even within a single implant site, bone density can vary. What happens when these variations in bone density are not properly accounted for? Let's examine drilling in case where hard and soft bone coexist. In soft bone protocols, undersized drilling is used to enhance implant stability. However, when applied to hard bone, this technique can cause overcompression. As a result, restricted blood flow may lead to bone necrosis and, in severe cases, implant failure. Hard bone protocols involve widening the crestal region to facilitate implant placement. However, this expansion creates a gap between the implant and the bone, leading to weaker fixation. In other words, conventional drilling protocols cannot achieve optimal fixation in implant sites with varying bone densities. The solution to these challenges is CMI fixation. CMI fixation divides the implant site into 3 parts: crestal, middle, and inferior. Bone density at each part is measured using a drill stopper. The measurement shows D1 for the crestal part, D4 for the middle part, and D4 for the inferior part. This is recorded as C1M4I4, or simply D144. The CMI drilling protocol adjusts drilling techniques based on the measured bone density. In hard bone, passive placement is used to minimize bone trauma. The tapping method prevents overcompression while evenly distributing force to the implant. In soft bone, active placement is applied to ensure stable fixation. As the implant self-taps into the bone, it achieves strong fixation even in soft bone. By combining the CMI drilling protocol with the optimized design of CMI implants, we maximize the bone-implant contact ratio, enhancing long-term stability and success. CMI implants are specifically designed to provide exceptional stability. Magic Thread distributes stress, reducing micro-movements and enhancing initial stability. The powerful apex features a self-compactable tapered design that enhances primary stability. The key to achieving anytime loading is overcoming stability dip. By combining CMI drilling protocol with the CMI implant, we maintain strong primary stability and accelerate secondary stability, eliminating the risks associated with stability dip. This ensures optimal fixation across all bone densities, making implant success achievable anytime.